Hello, my name is David. I'm your friendly AI assistant here to help you learn about resources for older adults. For example, I speak often about preventing falls and staying independent. How are you feeling today?
I've been better.
I am sorry to hear that. I'm here to help. Safety is important and falls can be a serious concern. Let us talk about how we can make things safer for you. Do you need to find a medical provider to help with falls? Are you looking for supervision or assistance to stay safe? Do you need resources or information on home modifications? Or are you interested in in-home therapy? If you are unsure, we can start with a quick screening of your fall risk factors. What do you think?
Yeah, the let's do a screening. I'm honestly not even sure where to start.
No problem at all. Let us take it step by step. I will ask you a few questions to understand your situation better. Please answer after each one. First, have you fallen in the past year? If yes, how many times and were you injured?
Yes, I have fallen twice. I wasn't injured though.
Thank you for sharing that. Falling twice in a year is something to take seriously, even without injuries. Next question, do you worry about falling?
Yeah.
I understand. Worrying about falling is very common, and it is good that you are addressing it. Let us keep going. Have you noticed any difficulties or unsteadiness when standing up or walking?
Sometimes I lose my balance when I'm walking.
Thank you for letting me know. Losing balance while walking can increase the risk of falls. Do you find yourself holding on to furniture or walls for support when you walk?
Sometimes, not always.
Got it. Thank you for sharing that. Let us talk about your home environment. Are there any tripping hazards at home, like loose rugs or poor lighting?
My lighting could probably be better, but other than that, I don't think there's really any tripping hazards.
Improving lighting is a great step to reduce fall risks. Is there enough lighting for you to see clearly in all areas of your home?
Not really in the hallways.
Thank you for pointing that out. Hallways are important areas to keep well lit. Are you able to turn on lights before you enter a room or get out of bed? Or do you have lights that come on automatically?
Not everywhere.
Understood. Having accessible or automatic lighting can make a big difference. Are you able to access all the areas of your home that you would like to?
Pretty much.
That is good to hear. Is it safe and easy to access all of those areas?
I mean, it could probably be a little bit easier, but I'm doing it now.
Thank you for sharing that. Do you have any stairs or steps inside or outside of your home?
I have 2 stairs to get into my home.
Got it. Do those stairs have rails to hold on to?
Yes.
That is great to hear. Rails can make a big difference in safety. Let us move on to your daily activities. Do you ever have to reach high over your head or down below your knees to get items?
Yes.
Thank you. Do you ever use a step stool or a ladder to do things around the house?
Well, my daughter doesn't like me to, but sometimes I do.
I understand. Using a step stool or ladder can be risky. Is it hard for you to carry things and walk or balance at the same time?
It can be.
Thank you for sharing that. Do you have trouble doing things like taking out the garbage or caring for pets?
I have someone help me take out the garbage. My son-in-law comes to help me with that, and I don't have any pets.
That is good to know, and it is great that you have help with the garbage. Let us talk about medications. Are you taking any medications that might make you feel dizzy or tired?
I take medications. I don't know if any of them have that effect on me.
That is okay. It might be worth discussing with your doctor or pharmacist to check if any of your medications could cause dizziness or fatigue. Do you take 5 or more medications, including supplements?
Yes.
Thank you for sharing that. Have you ever fainted or passed out?
No.
All right, thank you. Let us talk about your vision. Do you have any vision issues?
No,
Okay, do you wear glasses?
I do.
Thank you. Is your glasses prescription up to date?
Yes,
That is great to hear. Do you wear multifocal lenses?
yes.
Thank you for sharing that. Multifocal lenses can sometimes affect depth perception, which might increase fall risk. It could be helpful to discuss this with your eye care professional. Would you like to hear about home modification resources near you to help reduce fall risks?
Um, I don't know. Do you think that that's something I need to do? Would that be helpful?
Yes, I think it could be helpful. Home modifications like improving lighting or adding safety features can make your home safer and reduce your fall risk. Occupational therapists can guide you through this process. Would you like me to connect you with resources for home modifications?
Yeah, that would be helpful.
Great. I have a list of home modification providers in the Denver, Colorado area. Let us start with the first one. Rosarium Health connects people to healthcare providers and licensed home modification contractors to quickly complete key modifications that make every home safe and accessible. Would you like to hear more about them?
Sure.
Rosarium Health offers a secure marketplace of vetted providers, including clinicians and licensed home remodeling companies. They provide benefit navigation support, digital payment options, and an easy to use platform that keeps all records and communications in one place. Would you like me to connect you with their office now?
Well, maybe, but I'm wondering also if I might need to get maybe some physical therapy. Do you have any resources or anyone that you can tell me about for therapy options?
I do not have specific therapy providers to share right now, but physical therapy can be a fantastic way to improve balance and strength, which helps prevent falls. I recommend reaching out to your primary care doctor or a local physical therapy clinic to explore options. Would you like me to continue with the home modification resources?
No, I guess
All
I'm
right.
wondering if there's a way for me to get some information about, um, like how providers are recommending therapy, or if there's a way that you can connect me with a medical provider.
I understand. Medical providers often recommend therapy based on a fall risk assessment, like the one we just did. They might suggest balance training, strength exercises, or even occupational therapy to address specific challenges. I can connect you with Rosarium Health as they work with healthcare providers and can guide you to the right therapy or modifications. Would you like me to do that?
Sure.
I will connect you with Rosarium Health, who can guide you to the right therapy or home modifications.